Dr. Pickering, at the Glaucoma 360 meeting, you presented a talk on the impaired clinician and protecting patients. Interesting topic. Could you give us a little insight into your thoughts?
Absolutely, and I think insight is the operative word. As clinicians, we have to remember to be self-aware, not only of ourselves but of our colleagues, and to remember that we are prone to all of life's issues as our patients are in the general public. If we reach a point where we are overburdened with burnout or other issues that come up as life goes on, whether they're physical impairments, emotional impairments, substance impairments, we have to have the self-awareness and honesty to step back, take a break, and take care of ourselves so we can better serve our patients. If we likewise see this happening with a colleague, it's our duty in our professional collegiality to tell them as well, and also give them space and time to take care of themselves too.
Now, obviously burnout is obviously a big issue. Obviously.
Yes.
How much prevalence is, first of all, in burnout? How many physicians are really burning out in terms of getting an idea in terms of percentage, and at the same time, in terms of impairment, say drug abuse systems or alcohol abuse?
Right.
What percentage is that?
The data's always shifting. What I can remember most recently from a study from 2014 suggests that the burnout rate in physicians across the board is just a little over 50%. In practicing physicians, for ophthalmologists, it's just slightly under 50%. So, and that has increased compared to 2011. So they've been tracking this over the years. In terms of substance abuse, that's a bit more difficult to pin down. But for example, we know that in their lifetime, 1 in 10 physicians will become impaired. Of that 1 in 10, 90% of that group will unfortunately be a substance use problem.
So what do you recommend to practices? If it's partners or groups,
Sure.
What do you recommend to them in terms of all this kind of impaired clinician, what they should do or what steps do they be taking?
I think we need to raise our consciousness around the issue. It's not something that we've been taught in medical school or training at all. But now that we're in practice, now that we're recognizing it as an issue that we have to face, we have to raise our awareness and be able to recognize the signs and also feel confident in how we approach ourselves and each other within the profession. We are somewhat trusted by society to police ourselves, and we do have to perform that duty, and it is the right thing to do, colleague to colleague, versus having to get outside agency involved. Of course, that happens sometimes, but it is always better to have it early on, colleague to colleague, so that intervention can be made and someone's practice and life can be saved in some instances.
I think that's a good pursuit.
Thank you.